All right, so another name for a Medicare Advantage plan is Medicare Part C. Some people use that term. In this video, I want to explain to you some of the pitfalls of not only getting the Medicare Advantage plan, but actually trying to do the research on it. If you don't know who I am, my name is Brian Monahan. I've been a licensed insurance agent for 15 years, working with people like yourself going on to Medicare for the first time and people that are already on Medicare that want to switch their plan. And if you look in the description box, you'll see the first thing, my website address. If you click that, if you want to make an appointment, you can do it right on my website. Just hit the orange button, click the appointment. So you hit the link in the description box, go to my website, hit appointment, and set one up. And also, there will be some other information down there about Medicare Advantage plans and Medicare supplement plans. One thing that will be in the description box is my #1 video that's called Medicare Liars, which people have told me really helped them dissect the Medicare supplement plans and the Advantage plans to give them the know-abouts to understand what plan they want to pick. Anyhow, let's jump into the video. So the first thing that I want to say is in this video, I usually show charts and so forth. I'm not going to do that. In this video, I want to kind of get into a couple different stories about Medicare Advantage plans because that's how, forget the charts. Really, it's the experience of dealing with some of these plans, doctors, who takes the plans, what's actually going on with these things. So the first thing that I want to mention is most people, when they look at the plans, they'll find out maybe in the mail will come to them or they'll go on Google or they'll find out what plans are in their area. And so I recently spoke to somebody that wanted a Medicare Advantage plan. There's specific reasons why they wanted one. And so most of the time, 98% of the time, I'm dealing with Medicare supplement plans. But in this particular situation, they pretty much had to go with an Advantage plan. So I had to really dig deep with them and find out what the best plan for them in their zip code was. Here's the first problem. #1, if you contact your doctor, and you can do this yourself, you can contact any doctor's office. First thing that's going to happen, I can pretty much guarantee this. You call up and you say, do you take, let's just say Aetna, as you see on the screen. If they do take Aetna, they'll say yes. And you'll say, well, what plans do you take? Now, 9 out of 10 doctors are going to say, we take all the plans, or what do you mean by that? We take Aetna, we take PPO, we take HMO. But as you see on the screen, there could be 5, even 10 plans from Aetna or Humana or whatever it is, the company. And the doctor might not accept all of those. And sometimes they'll accept none of them, and they don't even realize they might accept the under 65 Aetna plans or Humana, but they don't accept the Medicare plans. Doctors' offices, if they don't do their own billing, or if you're not speaking to the person who does the billing, they are not going to know. I've done this 1,000 times. I have said in my earlier years, how I used to get clients is I used to go, because I used to train doctors in surgery for medical devices, I was able to go to doctors. I knew a lot of doctors and doctors' offices. And when I started doing Medicare, I reached out to some of those contacts, and I used to give seminars in their offices about Medicare. And then, of course, I started getting phone calls from people from their doctors' offices about their Medicare plans. So that's how I know doctors, nurses, people who are in these offices, they do not understand insurance. They just don't. It's not their field. They understand medicine. They understand a lot of things. But if they don't do the billing, they're not going to understand the insurance. And to be honest with you, there's no point to it anyway. So that's the first thing. You must find out, do they actually accept the plan? And if I were you, I would go with an agent. I would not try to do this on your own because #1, you don't pay for an agent. And #2, it's really, really tough. You'll get answers from the company saying, yes, that doctor takes it, answers from the doctor, and sometimes you have to do a little bit more legwork. Another thing is there's so many different plans. Now, I just put in one zip code, and I'm going to scroll very slowly going down the screen. And as you can see, there's different plans and different companies. There's HMOs, there's special need plans, there's different companies. The prices are different. The maximum out of pocket per year is different. The drug deductible is different. You really have to dig into each individual plan. And sometimes it's really difficult trying to compare these plans, because if you have to go to a certain specialist, they might take different plans than your primary care physician. Hospitals take different plans. This is something that's very, very serious, and it's hard to dissect. I actually, a lot of times I'll turn down people, meaning I'll say, listen, I'm not the guy for you. You need to call someone, about your specific plan, especially when it comes to Medicaid and Medicare. I don't do that at all. So I just tell them they need to call somebody else. But to dive into these plans is extremely difficult. Now, when you're talking about Medicare supplement plans, you're only talking about a few plans. The benefits are the same across the board. So no matter what state you live in, the benefits are going to be the same. Now, the companies might be different. You might not have certain companies in your state, and the prices are going to be different. But at least if you understand the plans, such as if you know what a G plan is, it's going to be the same throughout the entire country. You're not going to have to worry about studying different things. When it comes to the Medicare Advantage plans, you're going to have to know in and out, in your state, in your zip code, what plans are taken, what hospitals take those plans, what doctors, what specialists, outpatient centers, what about the ambulances? How much does that cost? There's a whole slew of things that you are going to have to learn. I hope you enjoyed this video. Please click on my video in the description box. It's called Medicare Liars. Most people have told me that really cleared up most of the confusion with their Medicare. I stumbled on this earlier in the video, but with the Medicare needs that they have, this video really helped them out. So thanks for watching the video. If you need me, give me a call or go to my website. Click on the appointment in the orange button, and I'll see you at the next video.